Hey everyone, welcome back for another deep dive. Today we're looking at something that's really been capturing my attention lately, and that's the impact of SGLT2 inhibitors on mortality in folks with type 2 diabetes.
Yeah, it's pretty fascinating stuff.
I mean, we know these drugs are great at helping manage blood sugar, but now we're seeing some really interesting research on how they might actually be affecting how long people live.
Right, and not just living longer, but specifically we're seeing differences in all-cause mortality, that's death from any cause, and cardiovascular mortality, so related to heart health.
Okay, so we're getting into the nitty-gritty here.
Yeah.
And to guide us through this, we've got a couple of really great sources. One is a meta-analysis that's looked at a bunch of different clinical trials on SGLT2 inhibitors and their impact on these mortality rates.
Definitely a good one to have.
And we've also got some insights from endocrinologist Dr. Praveen Ramachandra, who's really been digging into the implications of this research, both for patients and doctors.
And Dr. Ramachandra brings up a really good point about moving away from this one-size-fits-all approach to treatment.
Exactly, which is why it's so interesting to see how these different SGLT2 inhibitors are stacking up against each other.
Yeah, for sure.
So just as a quick reminder, the four main ones we're talking about today are canagliflozin, dapagliflozin, empagliflozin, and sotagliflozin. Now, they all work by helping your kidneys get rid of excess sugar, but this meta-analysis showed some surprising results in how they affect mortality.
Absolutely. And one of the things that really jumped out at me was canagliflozin. It seems to be a bit of a rock star, showing reductions in both all-cause and cardiovascular mortality. Pretty impressive, right?
Yeah, canagliflozin is like the MVP of SGLT2 inhibitors right now. So the question is, what could be driving those results? What makes canagliflozin so special?
Well, that's the million-dollar question. It could be that it has some unique effects on blood pressure regulation, or maybe it's impacting the heart structure and function in ways that other SGLT2 inhibitors don't. But to really understand why, we need more research.
More research is always the answer, it seems. Okay, but now this is where things get a little tricky. Dapagliflozin shows a reduction in all-cause mortality, but not specifically for cardiovascular mortality. Doesn't that seem a bit odd? If it's helping people live longer overall, shouldn't it also be protecting their hearts?
It's a really good question, and it just goes to show how complex these drugs are. It's possible that dapagliflozin is working through different pathways than canagliflozin.
Oh, interesting.
Maybe it's offering protection against other causes of death, like certain cancers or kidney disease, but having a less pronounced effect on cardiovascular events.
So it's like dapagliflozin is playing a different game entirely. Fascinating stuff. Now, what about empagliflozin and sotagliflozin? In this analysis, they didn't seem to show any statistically significant reductions in mortality.
Right, and that might seem a little surprising, especially given some earlier research like the MP-RED outcome trial that showed empagliflozin could have a positive impact on cardiovascular health.
Right, that one got a lot of attention. So how do we make sense of these findings? Are we back to square one?
Not exactly. I think this is where Dr. Ramachandra's perspective is really helpful.
Okay, tell me more.
He argues that these varied results just underscore the need for personalized medicine. It's not about finding a magic bullet for everyone. It's more about figuring out which SGLT2 inhibitor might work best for a specific patient based on their individual risk factors and medical history.
I see. So we can't just lump all SGLT2 inhibitors together and assume they'll have the same impact on everyone.
Exactly.
We need to consider each person's unique situation.
And Dr. Ramachandra really emphasizes that point. He believes this whole personalized medicine approach could be a game changer in diabetes care.
Okay, so this personalized medicine approach sounds great in theory, but how does it actually work in practice? Like, what questions should patients be asking their doctors?
Well, I think the most important thing is having an open and honest conversation with your healthcare provider. Really talk about your individual risk factors.
Okay, so what kind of things are we talking about here?
So things like family history of heart disease, kidney function, other medications you might be taking, even lifestyle factors can come into play. All of this information can help your doctor decide which SGLT2 inhibitor might be the best fit for you.
So it's not just about controlling blood sugar anymore. We're really looking at the whole picture.
That's exactly right. Dr. Ramachandra really emphasizes the importance of moving beyond just treating diabetes in isolation. You have to consider how these medications might affect a patient's overall health, their trajectory over time.
That makes total sense. But this personalized approach, it must require a lot more from doctors, right?
Well, absolutely. It definitely requires a deeper understanding of the nuances of all these different drugs
Yeah.
and how they might interact with a patient's individual profile. Doctors need to stay up to date on the latest research, and they also need to be comfortable having those in-depth conversations with their patients.
Yeah, it sounds like it's a much more collaborative approach to diabetes care.
Mm.
It's more like doctors and patients working together as a team to make these decisions.
You got it. And Dr. Ramachandra also highlights another really important aspect of personalized medicine, ongoing monitoring and adjustment. It's not a one and done kind of thing.
Ah, so it's not like setting it and forgetting it.
Exactly. Patients might need to try different SGLT2 inhibitors over time or adjust dosages based on how their body's responding and also how their health goals might change.
So it really is a dynamic process. It requires that continuous communication.
Right. And that brings us to another critical point that Dr. Ramachandra brings up, and that's the need for more research.
More research. Okay, I'm listening.
He argues that we can't just stop at documenting whether a drug reduces mortality. We need to go deeper. We need to understand why it works, how it works, and for whom it works best.
I mean, that makes a lot of sense. To really harness the full potential of these drugs, we need to unlock those secrets. So what kind of research would help us get there?
Well, I think one area that's really important is focusing on specific populations, like what works best for older adults or people with certain genetic predispositions.
Or maybe folks who have both diabetes and heart failure.
Exactly. By teasing apart these nuances, we can get a much clearer picture of how to personalize treatment effectively.
I feel like we're just scratching the surface of what we can learn about SGLT2 inhibitors and their potential.
Oh, I think we are. And Dr. Ramachandra's insights are really valuable in guiding this exploration. He's not just advocating for a new approach to treatment, it's more like a call for a paradigm shift in how we think about diabetes care.
Yeah, I love that. It's exciting to think about what this could mean for patients and what the future holds for diabetes management.
Definitely. And this brings us back to our original discussion on mortality. I mean, it's fascinating to see these recent findings on the different effects of SGLT2 inhibitors, but it's important to remember that mortality is only one piece of the puzzle.
Right. We can't get so focused on those mortality numbers that we lose sight of the bigger picture, a person's overall well-being.
Exactly. And Dr. Ramachandra reminds us that we need to think holistically about patient care. Think about the long-term impact of these medications on things like kidney function, cardiovascular health, and just their overall quality of life.
So it's not just about extending lifespan, but it's also about improving health span. Right?
Yes, you said it perfectly. It's about helping people with diabetes live longer, healthier, and more fulfilling lives.
It's interesting, right? We talk about living longer, but what Dr. Ramachandra said about knowing what works best for each individual, it really makes you think about quality of life, too.
It really does. You know, it's not just about adding years to your life, but adding life to those years. And that's where I think the shift towards personalized medicine is so exciting. It recognizes that what works for one person, well, it might not work for another, and that's okay.
Yeah, we're finally starting to understand that everyone's health journey is unique. We need to tailor our approach to that.
Exactly. It means moving away from that old one-size-fits-all mentality when it comes to treatment plans. You got to consider individual factors, preferences, even values when you're making decisions about healthcare.
So what does this all mean for our listener who's dealing with type 2 diabetes? What should they be taking away from our deep dive today?
Well, I think the most important takeaway is that they have a lot more power than they might realize.
Oh, I like that.
They're not just passive recipients of care anymore, right? They can be active participants in shaping their health outcomes.
So it's about being informed, asking questions, and really working in partnership with their doctor to figure out what's best for them.
Absolutely. And it's about advocating for themselves. If something doesn't feel right, if they have concerns, they should feel empowered to speak up.
Yeah. It's about taking ownership of your health. And it's really encouraging to see that research is starting to support this movement towards personalized medicine. I mean, studies like the one we talked about today, they really highlight those differences between SGLT2 inhibitors.
It's definitely an exciting time to be in this field, and I think what Dr. Ramachandra is saying, it's a call to action for all of us, really. Doctors, patients, researchers.
Well, for sure. We all have a part to play.
We need to keep pushing the boundaries. We got to challenge assumptions. And most importantly, we need to work together to find the best solutions for each individual person.
Well said. And one of the things Dr. Ramachandra said really stuck with me. Precision is not about treating everyone the same. It's about knowing what works best for each individual.
Powerful stuff, right?
Yeah.
It really sums up the whole idea behind personalized medicine, recognizing that each person is unique and then tailoring the treatment to them.
It's about giving patients the power to be a part of those decisions,
Yeah.
working together with their healthcare team to find the best path forward.
Absolutely. And it also means being open to new scientific knowledge, always looking for new discoveries, and then being willing to change our approach to provide the best possible care.
So as we wrap up our deep dive today, we hope you're walking away with a better understanding of SGLT2 inhibitors, how they can affect mortality, and what this whole idea of personalized medicine is all about.
And remember, knowledge is power. Stay curious, stay informed, and be an active part of your health journey.
I love that. Thanks for joining us for another deep dive. Until next time, stay well.
Stay well, everyone.